What are the demyelination patterns for each MS type? When we talk about multiple sclerosis, or MS, we are discussing a condition that affects the central nervous system. One of the key features of MS is the demyelination process, where the protective myelin sheath around nerve fibers is damaged. This damage leads to various symptoms and complications. The patterns of demyelination can differ significantly based on the type of MS a person has. Let's explore these patterns in detail. In relapsing-remitting multiple sclerosis, or RRMS, demyelination primarily occurs in specific areas of the white matter. Here, we see active inflammatory lesions where immune cells such as T cells, B cells, and macrophages infiltrate. During active inflammation, these lesions may enhance with contrast on magnetic resonance imaging, indicating a disruption in the blood-brain barrier. Between relapses, some remyelination can occur, but repeated episodes often lead to cumulative damage. Moving on to secondary progressive multiple sclerosis, or SPMS, we notice a shift in the demyelination pattern. In this stage, demyelination becomes more chronic and widespread, with fewer new inflammatory lesions. Instead, we see smoldering lesions that are characterized by a rim of activated microglia and iron accumulation. These chronic lesions exhibit ongoing low-grade inflammation and neurodegeneration, with less leakage from the blood-brain barrier. Axonal loss and gliosis, which is scar formation, become more pronounced. For primary progressive multiple sclerosis, or PPMS, the demyelination is more diffuse and less inflammatory compared to RRMS. In this case, lesions may show less contrast enhancement and more widespread activation of microglia. Chronic active lesions often have iron-laden microglia at their edges, indicating ongoing tissue damage. This pattern suggests a neurodegenerative process with a less prominent adaptive immune response. Additionally, we can look at histopathological patterns of demyelination. Pattern I involves T cell and macrophage-mediated demyelination while preserving oligodendrocytes. Pattern Roman II is similar but shows prominent antibody and complement deposition, indicating a humoral immune component. Pattern Triple I involves distal oligodendrogliopathy, where oligodendrocytes undergo apoptosis, leading to a preferential loss of myelin-associated glycoprotein. These patterns can correlate with different clinical types of MS and may representing various underlying mechanisms. There is also a rare variant known as Balo's concentric sclerosis. This type is characterized by alternating concentric rings of demyelination and preserved myelin, giving it an onion skin appearance on imaging. It is important to note the differences between acute disseminated encephalomyelitis and MS. Acute disseminated encephalomyelitis is a monophasic demyelinating disease that often follows an infection or vaccination. It typically shows diffuse, symmetrical lesions involving both white and gray matter, while MS lesions are usually multifocal and asymmetric, primarily affecting white matter tracts. Understanding these demyelination patterns is crucial for diagnosing and monitoring multiple sclerosis. It can also help guide treatment strategies. If you have concerns about multiple sclerosis or its symptoms, it is always best to consult with a healthcare professional for personalized advice.